how do you interpret the current situation in Sri Lanka, and what kind of advice can you give to a youngster like you saying we should look at uh, a life out of Sri Lanka? I mean, how would you answer that question?
Yeah. So I guess like everyone's situation is different. These are very trying and tough times. And I can't in good faith sit down and tell you, hey, if you have an opportunity in the US or in the UK or any part of the world, don't take it. Stay here. This is your mother country. You need to stay here. I can't give you that advice with good faith. The reason being that if you were to help the people, if you were to help the people around you, you need to make sure that you're secure yourself. There's only so much of yourself you can give to other people at your own expense. And the best way that you can magnify your impact in this world as a Sri Lankan to this community is to make sure you yourself is stable. And you're in this headspace where you're not worrying about finances, you're not worrying about your family, you're not worrying about health. You're in this creative space where you're able to create and think and envision a much greater future than what is already present. So secure yourself first. And then once that is there, and once you have this freedom to think and explore and like come up with creative solutions, once you are in that headspace, come back, then give back to the community, give back to Sri Lanka, give back to the people who've nurtured you, and establish these strong networks. And it comes with multiple benefits too. This means now, since you're secure, that impact that you're going to have initially is going to be 2, 3, 4 folds much stronger. It's going to hit harder. It's going to reach more people. And everything in life, especially these big impact kind of things, they're domino effects. You need to make sure that you're very sure of who you are as an individual and what you bring to the table. You need to be able to convince the people closest to you. And then the people closest to you are your advocates, and they're the ones that's going to drive the change.
So let me leave official introduction to Dr. Rohantha, but let me warmly welcome all our students and viewers on board to our session today. And apologies for a few technical difficulties and few other connection difficulties kept you waiting for a few minutes than earlier, but I'm sure wait would be worth when you start listening to the conversations. So to start with, let me warmly invite Dr. Rohantha Tukorala, one of our directors at Rapid Sri Lanka and the pioneering personality behind bringing this exposure to the students, to all of you for the learning purpose. And of course, he is also the Dean for Postgraduate School as well. So let me now invite him to officially introduce the speaker and start off for the day. Dr. Rohantha, over to you.
Thank you very much, Kaushali. And I'm in the midst of a whole group of people while I introduce Raveen. So that's the new norm that we have got used to working, doing multiple things, but focusing on the most important thing right now is about career development. So here's a gentleman who has a dual degree, student in bioengineering with concentration in conceptual medicine and medical devices in the School of Engineering and Applied Science, and in the Wharton School with concentrations in finance and entrepreneurship and innovation at the University of Pennsylvania. So for the first time, I think on our MBA platform of the last 100 top CEOs that we have interviewed, today we have a youngster who is from Wharton University, and I think it's an amazing thing. I just for your information, Raveen, we have had the chairman of Unilever, chairman of Nestle, chairman of um, I mean the top organizations of Sri Lanka like the Dialogues um, and NDB banks, HNBs, Virtuosas. All these people, and I think the first time we are having a Wharton school grad, because as you know, if you analyze the global CEOs, I think the highest number of CEOs right now in the top Fortune 500 organizations are from Wharton. So that's the kind of caliber we are having today, and we are absolutely proud of you. Um, he's also holds a master's degree in bioengineering, concentrating in brain-machine interface and advanced conceptual computation models for biological systems. With an interest in healthcare, innovation, and accessibility, this particular giant is involved in several research projects, which includes water on honors thesis, focusing on optimizing a low-cost electronic and medical record system in Sri Lanka and the Philippines. So he's not technically academic. He's more a person who loves kind of business and understands the power of research to drive consumer orientation in companies. He's also received several research grants, including the Vegelis Undergraduate Research Grant, the Beekman Opportunity Fund Grant, the National Science Foundation Innovation Corps Grant. At Penn, he also is editor-in-chief of Synopsis, the student-run health care magazine, and vice president of the Phil Sigma, member of Biological Honors Society. He's also a disc jockey. I love that. I love that one. Huh? Okay, he's a disc jockey for the student-run radio station, and is executive board member of the Wharton Undergraduate Healthcare Club. He's also a former student ambassador at the Penn Health Center, Health Devices and Technology. At Oxford, he plans to pursue a degree, a doctorate in philosophy degree, engineering science to develop culturally and contextually the way of medical platform that can shift the care paradigms of low resource settings. Ladies and gentlemen, I'm absolutely honored. The first time we are having a 23-year-old youngster at an MBA diary forum. Normally, MBA diary forums is only for CEOs of Sri Lanka, and we have had the top 100 CEOs of Sri Lanka featured here. So it's absolutely honor for me to present the 23-year-old from Sri Lankan, scholarship holder to the Oxford College, and a person who has got this scholarship after 51 years, because the last time that it had won was GLP. Ladies and gentlemen, Raveen Kariyawasam.
Thank you so much, Dr. Rohanta and Ms. Ruth and everybody else at Appit for this wonderful introduction. I'm truly honored to be here, especially at such a young age. It kind of blows my mind that you're willing to sit here and listen to me ramble about what I think the future of healthcare is going to be down the line. But yeah, I mean, I couldn't have had a nicer introduction. So thank you for that, Dr. Rohanta. I appreciate that. So in terms of discussion today, I'm pretty sure most of you are here because you read the poster, Future of Healthcare. So as Dr. Rohanta has mentioned, I've done my undergraduate at an Ivy League university, the University of Pennsylvania. I did my undergraduate, one of my undergraduate degrees in bioengineering. So I spent close to about 4 or 5 years working hands-on with computational medicine, clinical AI, medical image-based AI, medical devices. I have built quite a few medical devices in my time in lab projects and outside of lab as well. And then from the business standpoint, as Dr. Rohanta mentioned, I was also an undergraduate at the Wharton School. I studied finance and entrepreneurship. So I have experience in starting, launching ventures, understanding the capital needs for healthcare specific ventures and how that operates in the US. And I also hold a master's degree also from Penn, focusing more towards brain-machine interfaces. And that's the kind of work I'm hoping to carry forward while I'm at Oxford doing my PhD. I'll be working with Dr. Tim Dennison, whose work for Medtronic and has a couple patents that Medtronic uses for designing the EEG sensors for brain activity measurements. And Medtronic is one of, if not the biggest medical device manufacturer in the world. And I am hoping to democratize technology and bring it from like the cutting edge into more accessible platforms where everybody has the right to use it and have the ability to use it in the spirit, in the Sri Lankan spirit of providing free public healthcare. I'm trying to be at the forefront of bringing all these new technologies down to everyone, regardless of socioeconomic status. That being said, though, for the first couple minutes, hopefully I don't bore you too much. but I'm hoping to discuss to you what I see are some of the trends in the future when it comes to healthcare, not just in Sri Lanka and low resource settings like ours, but also in America and the Western Hemisphere. I would like to talk a little bit about the technology. I know Appit has a huge faculty in computer science and computer engineering, so I'm going to dedicate a reasonable amount of time talking about AI, the stuff I've experienced in my research, publications from friends and peers and professors across multiple disciplines. Then I want to talk a little bit about hard tech in terms of like making devices and how that plays out. Then to cater more towards like the law faculty, I'm going to talk a little bit about the gray zones associated with the legalities of these futures of technology, how regulation down the line between America's FDA versus European regulations will kind of cause a rift in terms of medical technology, and also like how some policies maybe in China is also going to like kind of impact how the race for medicine and technology is going to happen in the next couple of decades. And then finally, more towards the MBAs and the business oriented individuals, I'm going to talk about VC funding, how venture capitals have changed over the last couple of decades in Silicon Valley, in America, and also a little bit about the VCs in Europe in terms of healthcare and how the playing field is now if you want to launch a healthcare-based startup. I know that's a lot to take in. That's a big introduction, but we'll break it down little bit by little bit. So starting off with the technology side of things, one of the bigger things that we all know about is artificial intelligence. Now, artificial intelligence is in everything that we can possibly think of. And now artificial intelligence is slowly, albeit kind of relatively new kind of thing that's coming into medicine, I would say. Its penetration in the clinical setting is kind of small. It's happening slowly, mostly due to regulatory processes across the different countries and continents that kind of inhibit what's happening. But if you take the research alone, AI in medicine has progressed quite a bit. We have multiple corporate commercial partners and corporate entities such as NVIDIA, the graphics processing company, AMD, all kind of like putting in their resources, trying to come up with these toolkits for the next decade or so in healthcare. AWS and Microsoft are also right behind everyone's heels, coming up with AI, machine learning, cloud-based technologies that you can use as an app creator. Right now, a lot of these services are in their beta form, but it's out there if you want to develop some sort of cool app that leverages machine learning and computer vision in the medical space specifically. So as you all know, artificial intelligence is just a bunch of algorithms that kind of give the computer, as simply as I could put it, excuse myself from the statisticians and the mathematicians, I'm going to give a completely dumbed down version of what AI is. But essentially, you're giving the computer some sort of autonomy, saying, hey, here's an image or here's a bit of data. In the past, these are the kind of connections you've gotten. What do you think this prediction is going to be if I give you this kind of data? And we're trying to use computers now more and more to provide some sort of evidence or heuristic to make better judgments in medicine. One of the more common versions of AI that we all see and love is computer vision. Face recognition is one of it, and all of you guys probably have it on your phones. If you have an iPhone, a Samsung, you could use some sort of face recognition that uses computer vision. So now in the space of medicine, now a lot of the things that happen in medicine, when we go get diagnosed, a doctor doesn't necessarily come up with a diagnosis almost immediately just based on symptoms. If it's a more complicated thing, let's say you have tuberculosis, you need to go get a chest X-ray. You need to get some sort of internal imaging done. Once you get an internal image done, it's the radiologist's job who sits down and looks at these tiny irregularities that it's hard to spot for the naked eye. But due to their experience and training, they do this. But it's fine if you're doing a handful, but when you're in like a high stress, high pressure environment where radiologists are few and far in between, it kind of gets tiring, and like you need some sort of help to kind of help sort out these images into buckets and kind of make the diagnosis process faster. So that's where computer vision comes in. Some of the more popular places where computer vision has currently been used is in dermatology. For example, when you have skin cancer or you have, let's say, a mole or something that could be indicative of UV radiation induced skin cancer or whatnot, what you can use is computer vision to analyze images of a patient's mole or lesion over a couple of days or weeks and automatically elevate the process by saying, look, this patient is actually in risk of skin cancer, the mole is growing. Or it could be like, hey, it's just, they were just born with a mole, nothing to be concerned about, it's not growing. So there, AI is providing a very useful feature of tackling important cases from not so important cases. Similarly, AI could be used for segmentation, for example. Let's say you're talking about the brain. Now, the brain is made of multiple components. And if you're doing very, very complex brain surgery to deal with Parkinson's or you're putting some sort of neural implant, the different parts of the brain are very important. And contrary to popular belief, the brain is not like exactly the same for every single human being. Different parts of the brain vary based off of ethnicity, based off of genetics, based off of gender, based off of sex, and like all sorts of other compounding factors and age. So when you're dealing with some sort of operational lobotomy or something where you're removing a tumor or like a certain part of the brain, you need to be able to identify what region of the brain you want to do so. And these regions vary from patient to patient. And the boundaries for this change is very minuscule. So that's where segmentation comes in. So usually a radiologist would sit down and like manually draw hand by hand, pixel by pixel, and be like, hey, this is where I think the hypothalamus is. Or sorry, hypothalamus is a pretty obvious regional part of the brain, but some part of the inner cortex, let's say. And that's where the lesion is. But a radiologist sitting down, that might take them about 20 minutes, 30 minutes for one patient's image. Now imagine doing that for all patients in a ward, and especially in a public healthcare system like Sri Lanka, where radiologists are already taxed. Just imagine the number of patients they got to go through in a single day. And like the room for error is high because we're all humans, we're not machines, you know, like we're going to get tired, we're going to get a little weary, our eyes are going to get a little bit blurry, and like we might move our cursor a little too much to the left, and that could be fatal for a patient when it comes to a lobotomy or like a tumor removal. So that's where computer vision comes in. Computer vision helps us to automatically segment these images into the different regions we need quite quickly. And that allows us to do pretty cool stuff in the realms of personalized healthcare, which all parts of the future, in my opinion, my humble opinion, is going to lead to. That's what we want at the end of the day. Everyone getting a very hyper-personalized treatment care for them, hyper-personalized medication, hyper-personalized surgical treatment, so that you can get better as quickly as possible with as minimal side effects. So that's where AI usually lies, the more popular versions being in computer vision. But AI is also spent in the realms of like decision trees. If you go see a physician these days and they ask you for a bunch of symptoms, they'll be like, do you have a cold? Do you have a headache? Do you have a fever? Do you pass blood in your urine or something like that? But if you think about it, the decision process for a doctor is a bunch of yeses and nos. And the reason why they're able to make a diagnosis relatively quick alongside these lab results is because of experience. They spend decades of their lives learning and training to be immaculate with their diagnosis. But at the essence of it all, it's just knowing the right question to ask and making sure that the patient's being truthful and coming up with a diagnosis. So it's just a bunch of decision trees if you were to simplify this noble field. For that, AI, again, would be vastly important and vital. For example, IBM has been doing experiments with this. So they have a supercomputer called Watson, named after, I believe, Sherlock Holmes' sidekick, Dr. Watson. But the supercomputer Watson was given cases where they were trying to train Watson to make these diagnoses for patients based off of very confusing symptoms. And in some cases, Watson was very successful in detecting like very rare incidences of a disease or genetic ailment that might not regularly come up just because it's not common, just because Watson knew the right questions to ask and got the right information. That being said, though, Watson, it was kind of shut down and kind of put back into the works because it had some errors, and that's where like AI needs some work and tuning with. But we're definitely getting there in the whole diagnosis decision tree process. So there we talked a little bit about AI and like how it helps with radiology. And we talked about how it helps with diagnosis. Then there's like a whole range of healthcare that we don't even see on a day-to-day basis. We talk about the nurses, we talk about the physicians. Those are the people we come to face with on a day-to-day basis. But we also have individuals on the more pharmaceutical side. They're the ones who design the drugs, the vaccines that we inject in ourselves for immunity or to get better. And in that realm, AI becomes super important because they help with things like using computer technology to predict what kind of chemical compounds will react well for a particular ailment or disease without having to spend money on costly animal tests, human trials, without putting people at risk. Now the standard is becoming such that we do computer clinical simulated trials first before we move on to animal trials and human trials, so we can make the compounds that we kind of funnel down and select much safer for consumption and use. And the cool thing is this can happen much faster because you don't have to wait. You can come up with like 1 billion compounds and then put this on a supercomputer cluster and run the numbers and protein folding and all of that and predict how the compound will affect a particular protein structure, which in turn will affect how it'll manage our symptoms for us. Whereas previously, you're going to have to like think about it a lot and be like, you know what, I think these 10 compounds are probably the best bet. And then you're going to have to chemically manufacture it. And then you got to give it to animal tests and then move it on to human trials and then finally get FDA approval, which is like a 10, 15-year process. But now you don't have to guess. You can run all 10,000 compounds that the computer thinks is viable and see which ones work and then break it down from there. AI in that realm is led by Google's DeepMind team. I believe they have something called deep folding or deep protein folding or something along those lines, where for the first time ever last year or 2 years back, they generated an AI model that can pretty accurately predict how protein structures fold in 3D space, which is super cool to hear as like a biologist, because protein folding is notoriously difficult. And you can go ask your biology doctor friends and they'll tell you why. But proteins can fold in multitude of ways, even though they might have the same chemical elements and they form the same bonds. But the way it forms those bonds in the 3D space can differ from sample to sample. But now we can predict that and come up with really cool use cases and predictions. Okay, so that's enough a little bit about AI. Now let's talk a little bit about hard tech. So in realms of hard tech, there's always going to be improvements in imaging. So we're going to come up with better ways and faster ways to do CT scans, MRI machines, X-rays, PET MRIs, all of which have some sort of function, but essentially they want to see the functioning of your insides and see whether it's abnormal or not. The growing trend right now in the fields of, let's say, ultrasound scanners and CT scanners, MRI scanners, is to try and come up with more cost-effective devices that can be shipped off to low resource centers. The problem with these devices has not so much to do with the technology. The technology is great. The resolution for all the things that we need to do, pretty wonderful. You'd be surprised by the number of things you can do with an X-ray machine. That was even like made like 2 decades ago. The problem here, though, is that these equipments are super expensive and super bulky. So you can't ship this off in a heartbeat to, let's say, some rural part of Africa and be like, use it in this village. It's just because they are super bulky. Like, for example, an MRI machine, you need huge, vast amounts of space, at least like 2,000 square feet. You need a cooling chamber. And just imagine going like the middle of Africa and being like, look, I need like a $10 million investment to like put up one MRI machine. And like these machines are so costly, like most of the machines in Sri Lanka, albeit not in the private sector, in the public sector, please correct me if I'm wrong, but I do believe a lot of them are secondhand donations from wealthy countries like Japan, where it's so much cheaper. So usually like developed countries, like in America, even the hospital I worked at Penn, every time Penn is one of those leading research institutes in the world, top 3 easy, always trading blows with Harvard. But to stay on top of their game, they need the newest technology. So what they do is every time a new machine comes out, they get it and then they take their old machine and ship it off to some part of Africa or any other low resource setting that might need it. So there are a bunch of startups led by Dr. Jonathan Rothberg. And this is a very interesting use case. Dr. Jonathan Rothberg is the individual who came up with a machine that did genomic sequencing. So he's the guy who was able to create this device where you literally give it your DNA sample and literally less than half a day. Now it's probably 2 hours, I believe, but less than half a day back in the time, he will tell you your entire genetic makeup, every single gene in your body as you as an individual. It'll print out and tell you. And you can use this with the genomic biobanks from the UK and stuff and figure out like what genetic ailments you have. And that revolutionized medicine. That changed the game for everyone. So this individual is a serial entrepreneur, and I had the good fortune of speaking with him like a couple of times. He's come to our classes. I had one-on-one interactions. And an amazing individual, but he truly believes that philanthropy in the space of medicine can only really happen through business, where you're trying to commercialize, you're trying to make these products like CT scanners, x-rays and whatnot, super hyper profitable by competing in the private space and trying to be competitively viable. So two of these interesting startups is like, here's something called a butterfly ultrasound scanner, which is the world's first digital ultrasound scanner. And it's like, yeah, big. It's like this big. It's like a hair clipper. It's wireless. It connects to your phone, and it can do an ultrasound on your body. An ultrasound, put it in context, a regular machine is around 15,000 US dollars. And you need like a huge, like trolley sized machine, and it's now portable, and you can't take it in a suitcase if you're like in Doctors Without Borders. But the butterfly ultrasound machine is just like a hair clipper sized device. It connects to your phone wirelessly, and you get the display output on your phone, and it runs off of AI and machine learning. And it's a digital sensor, so you can travel with it wherever you want. You can do like Doctors Without Borders, like that's just game changer to have an ultrasound machine on hand in like a war-torn country. The lives you could save is insane. So that's one cool thing that he's doing. And then another thing is he's working on a portable MRI machine. So like I mentioned, an MRI machine takes a whole room, right? This guy, he was with his team, he was able to bring that down to like a trolley. And you can easily put a trolley on Qatar Airways, check it in and take it to Africa and like do CT, MRI scans of patients in villages. You can't take a 5,000 square foot room with you. So that's game changing. And that's where I see a lot of the hard tech coming. It's like making existing scanning diagnostic devices smaller, faster, and much easier to run on a digital spectrum. Then the other cool thing that's coming up is wearable technology. A lot of you are probably familiar with smartwatches. The goal right now is to tack on as many sensors as you can. Like you'll be surprised by the number of insights we can get from body temperature, from heart rate, your breathing rate. And heck, like you can even do a complete ECG on an Apple Watch now, which is insane to even think about. But these like minor variations of these, like what you would consider minuscule or minor diagnostic measurements, if you track them for long enough, you can come up with some pretty accurate diagnosis much before, well in advance of things getting worse. And as we all know, prevention is definitely better than the cure. So with like an Apple Watch, you can track your heart rate, and like your watch, even now, like it'll warn you when your heart rate's irregular, so you can go and get checked up before you have a heart attack, before you require emergency services. And the potential with wearable technology is immense. We have a lot more like outlandish kind of things coming up too, where it's like subdermal, so under your skin devices where you don't even see, like you don't need to wear a watch, it's just continuously tracking you. Then the other cool thing that's coming up right now, thanks to Elon Musk, is the brain-machine interfaces. Most of you are probably familiar with Neuralink, but essentially what Neuralink is doing is like what a bypass does to a heart patient. With a heart patient, let's say you have a blocked artery, what you do is you kind of create like a different tunnel or connection for the blood to bypass the blood pump and allow your body to function as normal. The same thing's happening now with Neuralinks, except with nerves. So nerves are extremely complicated. But now if you have a severed nerve, or if you're paralyzed, the reason why you're paralyzed is that nerve connection is broken. Now what Neuralink is doing is it's connecting a little bridge between the two and wirelessly transmitting the information from your brain, bypasses the break in your nervous system and goes to the rest of your body. So you can start using, you can like cure yourself of paralysis. Of course, it's still in the works. There's also another research team, an Italian-based team, that have shown quadriplegics, so individuals who've lost complete feeling of their legs. They can't walk or sit or anything. Their legs, anything waist below does not work. But with a similar technology, the Neuralink, they've hijacked the nervous system, and they are bypassing the brake in the spinal cord and allowing these individuals to start using their legs, and they can move. And this just happened literally a year ago. So 10 years from now, the sensitivity of these devices is going to improve. The research is going to keep going. Funding is going to start flooding in, and there'll be an explosion of these technologies within the next decade or so. The only question is whether we'll ever actually get to see it in our lifetimes because of regulations. And that brings me to the second portion of our conversation, and that is law. So we talked a little bit about AI, but now we got to talk about the reason why we don't see AI in the real world in the first place. Well, AI comes with certain levels of autonomy, and the more autonomous a device gets, then the question becomes, at what point do we put blame or responsibility on the AI? For example, like if you take in the case of medicine, if a surgeon does not perform a surgeon optimally, and you have reason to believe that they were negligent, you can sue the surgeon and be like, look, this is malpractice. What the heck are you doing? But let's say an AI was the one who came up with the diagnosis. Like, can you blame a computer? Can a computer be held accountable in a court of law? What punishment do you give a computer? Upload a virus onto it? Like, there are a bunch of gray zones in terms of like the ethicality behind it, and like how punishment, like how can we deal with consequence and make sure that the AI is working in our favor? And how do we know AI work? How do we know that the AI is making the optimal decision? Because one of the biggest problems in AI, regardless of what discipline you're in, is the simple fact that AI works in a black box. AI is able to come up with extremely brilliant outcomes that we, just as humans, we will just never see the pattern because we have biases, animalistic, heuristical biases that we can't overcome, but a computer can. But the thing is, when it does that, we just don't know how it does it, how it manages to do it. It's completely in a black box, and we can't decipher the black box. We don't know what kind of instruction it went. It can't explain to us in a logical sense how it came up with its decision. And that's scary. How do we know that the computer is not running based off of simple luck? How do we know that it's an ethical way of doing something? It's viable. Like what if an AI is like purposely killing certain patients so that it can harvest kidneys to put in other patients? And we'll be like, oh, look at us. The mortality rate is like 25%, but it turns out that the machine's just making sure it kills like 25 people out of 100, taking everyone's the kidneys out of all 25 and then putting in people who have disease. And then it looks like, oh, look at this, the output, the recovery rate is insane. So that's that. We have a bunch of gray zones associated with it. And that's the issue with regulation and law. How do we keep devices accountable? And one of the things that people have discussed in this realm of accountability with AI and ethics and law is, what if we keep the creators accountable? But then that brings us back to our original problem with the whole black box thing. Sure, creator is the one who like designs the algorithm, but that doesn't necessarily mean the engineer or the creator understands what decisions the algorithm is making. So that doesn't make sense. Then the other way that people have been thinking about regulating AI is that the AI permeates biases and heuristical shortcuts that its creator has. For example, if I'm designing, for the most simple case, let's say, I am trying to design an algorithm that figures out which numbers are divisible by 3. And my heuristic is that if the last number of the whole number ends with a 3, 6, or a 9, it's divisible by 3, and it's a shortcut. Right? So that is my box. That's what I've been taught in school. So that's what I'm going to do. I'm not going to actually sit down and divide the whole number by 3 to see whether it actually divides. I'm just going to look at this shortcut and see whether it's divisible. And this is a pure math example. So obviously it's divisible. But let's abstract that simple concept to something more complicated, right? Let's say we are looking at testicular cancer or something. And then my heuristic is like, oh, if it's a male who's over 60, who happens to be white, Caucasian male, there's like an 80% incidence of testicular cancer. And when I'm training, there's bias that comes into the AI because I might prioritize in the training set patients who are white male who are 60 and have more labels that show that they have testicular cancer. And now this AI has adopted the biases of me as the creator, and it's permeating the same mistakes I would typically make. And the whole point of having this AI is to have this impartial, non-judgmental way of doing and dealing with things. So how do you keep that accountable? How is it possible? And this is a huge, hotly debated topic with autonomous cars. And the same is going to happen to medicine. With autonomous cars, like let's say you have a completely autonomous Tesla and you're driving, and what if it comes across a place where it has to crash? It has to decide between killing a child and killing an old person. And there's no other way to do it without say, or kill the driver, the passengers in the car. What should the car prioritize? And let's say the car chooses to prioritize the passenger and kill the passenger, the old man or the child on the street. Then the demand for Tesla plummets. Like, who would want to be, like, as a passenger, as a pedestrian, would you ever be safe knowing that there are Teslas that will always choose the people, like their own life, the driver's lives over the pedestrians? Like, then it becomes a society where people who have money to buy a Tesla are inherently going to be safer, which is problematic. You're having systematic privilege being permeated through already divided socioeconomic classes just simply because of AI. And likewise, like, would you ever buy a car that decides to be this ethical god? And, it's like, oh, if there are two individuals outside that are going to die, you know what, I'm probably going to kill myself. I'm going to kill the passengers in my car. Would you buy a car like that? And I'm willing to bet some money you wouldn't. So there are a lot of gray zones dealing with this, and this AI complications are definitely going to be in medicine. I wish I had more examples in medicine to bring up, but the thing is that AI is just slowly being rolled out in the field of medicine, that we can only come up with similarities in like adjacent complex use cases, like with autonomous driving. Like, I do not have like explicit autonomous medical based AI legality, ethical kind of conundrums, except maybe one thing that we can consider is, like, if you take dermatology, for example, there has been a huge cause for concern where dermatology had the handbook, the manual, the de facto guide on dermatology was written by a Caucasian group of white individuals. And then, but not everyone's skin is white. If you have darker skin, if you have more melanin, the way a rash or a pimple or acne kind of manifests on your skin is very different from somebody who's fairer. And then because of that, there's like issues of diagnosing between races and ethnicities because of skin color. And then AI is obviously going to have the same biases because it's going to be trained by an engineer or a doctor who has been trained with the classical Caucasian manual. But they're fixing that. They're changing all this, trying to come up with more diverse perspectives in medicine. Then we come to, within law, we talk about regulation. So we have the FDA, and then we have European regulations. So in general, European regulations far stricter than the FDA approval process. That being said, both are pretty strict. In countries like Sri Lanka, there is not much of a regulatory framework that kind of protects patient information, patient safety and whatnot. Like, we're getting there, but there's a lot more work to be done. But the regulatory frameworks are pretty important in terms of like how research is being done. The FDA has like fast track approval processes for life-saving technologies, as we saw with the mRNA COVID vaccines. And what essentially would take 5 to 10 years becomes expedited into 1 or 2 years. European regulations far stricter. So therefore, if you think about the regulatory process, companies that are more US based, they find it much easier to innovate. They can iterate faster, they can fail faster, come up with better drugs, come to market faster. And therefore, patients in the US will have access to these cutting edge technologies that could literally save someone's life much faster than if you were in the European Union. But if you're in the European Union, you have the kind of peace of mind knowing that, look, we went through stricter regulation. Whatever I'm going to put in my body is like, I'm damn sure it's going to save my ass. You know, it's safer. But there's an issue of innovations type of, like, if you consider the issue in terms of populations over larger time scales, 3, 4, 5, 6 decades, what you want to gun for is optimizing medical safety. You're looking at the long-term health of your population. But think about it on like a more individual family level, like your grandfather has a degenerative disease and you want to see your grandfather live for another 20 years, or 10, 20 years, but he might only have 6 months. Just because of the regulatory body, if your grandfather was in America, he could probably get cured and have a new lease on life. But if he was in Europe, well, tough luck, you're gonna have to wait and you might actually die before you ever get a chance to use this life-saving technology. So regulation is a big concern in terms of like how these cutting edge technologies manage to come from research labs that we all hear about and get published, but how it comes to you as an individual. And that's where one of the biggest timelines. It's not the innovation process. It is not the research process. It's a little bit to do with, it's mostly to do with the regulation process. And then once the regulations in, commercialization is pretty straightforward. And that finally brings us to the last thing I want to talk about, the business aspect of it, commercialization. So one of the biggest things to understand is that there is a shift in thinking between the biggest funders in the healthcare space. If we take history, let's take 60s, 70s, 80s. During that time in the US, the funding structure for a healthcare startup was vastly different. A lot of VC firms wouldn't even touch healthcare startups because regulation takes a while. It takes 10 to 15 years before you see something in the market that might actually earn you money. But the thing is, like in those 10 to 15 years, you have phase 1, phase 2 trials. Phase 1, you have a 40% chance of succeeding. Phase 2, you have 20%, 40% chance of succeeding. In phase 2, it becomes even low. You have 10, 20% chance of succeeding. And likewise, your opportunity to make profit off of this one chemical compound or medical device massively diminishes. And as a VC firm, like, especially at the time, like, why the heck would you spend billions of dollars on something that might have like a 10% chance of being a hit in the market? Whereas if you invested in tech companies or web.com companies, no regulation. It takes less than 5 years to go to market. Minimal capital costs, especially if you're doing software. And then boom, you're making billions and the reach is insane. Like, as long as your consumer has an internet connection and computer, that's money. Whereas with like these costly medical devices and pharmaceuticals, you have to deal with the insurance companies, especially in the US. You can't just directly sell to a patient. So your addressable market drops drastically. People who have insurance, then you got to figure out whether insurance companies are willing to pay you money. Because just because it saves money or saves the lives doesn't mean an insurance company is going to pay for it. For them, they'd be like, you know what, I've always paid $5,000 for a bypass. Like, I don't need a stent. I'm not going to pay for a stent. I'm not going to pay $10,000. My client does not need to live any longer. We've done it this way. There's a lot of resistance, a lot of momentum to come through. And there you go. Your 5% success rate goes down to 1% because you need an insurance provider to give you an insurance code. So like when the hospital bills you, you get paid. And that kind of makes it really tough. So VC funding in this space dropped at the beginning, practically non-existent. Over the years, especially with health devices, with AI being involved, more tech-savvy individuals coming into this medical space, and with the lessening of the regulatory bodies, especially FDA, with having fast-track processes, different classes, categories for approval, it became much easier and more lucrative to make healthcare startups. And right now, healthcare is one of the hottest spaces to come into in terms of VC funding. A lot of individuals are securing funding left, right, and center if they're AI-based, if they're in medicine, if they have blockchain involved. Healthcare is a big thing, and VC funding has grown off the charts. Angel investors are coming in, and it's less risky now. And AI and computer technology and computational modeling is one of the biggest reasons why it became less risky and easier for individuals to understand what's happening. And it's also helpful that a lot of the populations in the world are aging. We're dealing with pollution. We are dealing with new sources of ailments. And healthcare is honestly, if positioned correctly, is a recession-proof business. People are always going to be sick. People are willing to go to extreme depths to save their lives or the lives of their loved ones, and money goes out the window. and they're willing to do whatever they can. So provided that you're in a position where you're able to provide services at a reasonable price that is not going to discriminate everyone. I understand, like, for innovation and like sustainability to occur, you can't run a charity. Business has to be a reason why that the product or device or the life-saving technology is out there. But you want to make sure that the majority of people, especially the people who you did think need access to it, have access to it. And thinking about the business side of it, the regulation, coming up unique business models where the end user doesn't get taxed or have to pay a price. That's where I think we're all heading towards in terms of the future business in healthcare. Accessibility is number one. And the more we can get accessibility, improve accessibility across all disciplines of medicine, the better everyone's going to be from a money-making standpoint, from a regulatory standpoint, from a patient-centric standpoint. It is the future. And finally, as I've tried to touch upon these little individual topics that I've spoken about for God knows how long, way too long. I'm sorry for boring all of you, but this is a bit of an ego boost for me. So thank you for letting me have my moment. But what I was trying to get through at the very end is that all of these individual aspects from healthcare, from law, from the tech side, what we are all slowly gearing towards is personalized healthcare. To give a quick example, you and your mother might be very different individuals. For example, you might have a headache. Your mom might also have a headache. You take paracetamol, she takes paracetamol. But paracetamol might work for her, wouldn't work for you. You're going to have to take something else. You might have to take Panadol. But what's the difference? You know, you both have the same headache. You pretty much share genetic information. But why isn't the same drug helping both of you? And that's the question that plagues a lot of the issues in the healthcare system. Because of the number of people that we have to go through, we can't give individual attention. We can't create individual genetically purpose-built medicine for an individual. We can't do individual specific testing and diagnosis. And because of that, we have side effects. Because of that, we have deaths. Because of that, we have complications. So the goal, and this is the future that I truly, truly hope I'll get to see in my lifetime, is this realm of personalized health. When you walk in, you get to control your health from start to finish. You, as the patient and the consumer, you know exactly what ailments you have. You are informed about the metrics. You are able to take all the tests you need, blood tests, ECGs, EEGs, all at the comfort of your home. You can track them over a long period of time that's specific to you, securely stored, because there can't be job-based discrimination, insurance-based discrimination if all of this gets leaked out. Then you send this to a physician or another individual who will augment or sign off on the diagnosis that an AI machine makes and sends your genetic composition to a pharmaceutical manufacturer and be like, hey, this individual, he gets headaches every 4 hours. We think if we give them exactly 88 milligrams of paracetamol combined with like 12 milligrams of codeine, we can cure his headache in 1 hour instead of 5-6 hours. And you get it. And those numbers are designed for you, your genetic makeup, you as an individual. So you have no side effects. You have no complications, no kidney disease, nothing. And let's say it's something more complicated. You have to get a surgery. Guess what? We're going to 3D print you your kidney, your replacement kidney. We don't have to wait for donations. We don't need to kind of like vultures wait for somebody healthy to die and use their organs. You don't need to wait for a blood match. Anything in your body that's ailing you, we will come up with a customized, personalized solution for it. And every drug, every surgical procedure you take is designed from the ground up for you as an individual, because you deserve to live healthily and happily without the fear of complications, death, and the financial cost and burden. You know, each individual is different. And this is one way where we can make sure that we can target each patient, each consumer at the price level that they needed to be charged and get them as minimal complications and side effects as possible while giving them maximal care and benefit that they deserve. All right, ladies and gentlemen, that was my long-winded talk going through the aspects of law, tech, business, and how all of it culminates in the future of healthcare, which is personalized healthcare. Thank you so much for listening to me ramble for quite some time. If you have any questions, I'd be happy to field them. And over to you, Dr. Rohanta.
Hi guys, lovely. I mean, that was fantastic, Raveen. So, Raveen, let me ask you, what 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 really motivated you to aspire to such high aspirations? I mean, what made you do that?
Yeah, that's a good question. Um, so it all started out, I guess, like twofold. Firstly, it was me as a kid. I was 4 years old. My grandfather passed away when I was pretty young. He had kidney complications. He couldn't see towards the end of his life. But this is a man who's lived life to the fullest. Everyone loves him. He's uber generous, and he was such a blessing. And I was wondering, why is it that such a wonderful man, with all these karmic beliefs we have in Buddhism and Hinduism, like why did such a wonderful giving man with no, uh, not even the slightest malice of at all, had to suffer like that? And it was uneasy for me as a 4 year old dealing with the death of my grandfather. And growing up, I always was like, I don't want this to happen to my I didn't want this to happen to my parents. I don't want somebody who has to be in the mercy of something that is beyond their control. Life is hard as it is. I genuinely don't think that people have to sit down and have to come up with this conscious decision. You know what? I'm going to have to let myself suffer and die so there's enough money for the rest of my family to live. And this situation was exacerbated when I went to the US, when I've heard stories from my work, from my friends, where they talked about relatives, where they were like, they got $2, $3 million bills, even with insurance. They were like, if I choose to live for another 2 years, the rest of my family is going to be in debt. And I can't let my family suffer for the things that's out of our control. And that was more or less luck based. So that got me thinking, and I really wanted to be in this space where I'm trying to like make sure everyone has better access to healthcare, especially the most cutting edge healthcare technologies, because I don't think it's fair that we lock it up in a research center and not letting people who need it the most, the people who are strapped for cash, people who are suffering the lowest rungs of society, they need to be able to come up on their own 2 feet without having to worry about their own health. They should not have to make the conscious decision between family, future, and their own well-being. So that's why I got into this whole space, and I'm very much motivated to make sure that this equality is established sometime in my lifetime, at least 10%. I want to make sure that people can rest easy knowing that their health is the last thing that they have to worry about.
Raveen, what do you see the way that, I mean, you're now going to be based in the UK, but how do you interpret the current situation in Sri Lanka, and what kind of advice can you give to a youngster like you, saying we should look at uh, a life out of Sri Lanka? I mean, how would you answer that question?
Yeah. So I guess like everyone's situation is different. These are very trying and tough times. And I can't in good faith sit down and tell you, hey, if you have an opportunity in the US or in the UK or any part of the world, don't take it. Stay here. This is your mother country. You need to stay here. I can't give you that advice with good faith. The reason being that if you were to help the people, if you were to help the people around you, you need to make sure that you're secure yourself. There's only so much of yourself you can give to other people at your own expense. And the best way that you can magnify your impact in this world as a Sri Lankan to this community is to make sure you yourself is stable. And you're in this headspace where you're not worrying about finances, you're not worrying about your family, you're not worrying about health. You're in this creative space where you're able to create and think and envision a much greater future than what is already present. So secure yourself first. And then once that is there, and once you have this freedom to think and explore and like come up with creative solutions, once you are in that headspace, come back, then give back to the community, give back to Sri Lanka, give back to the people who've nurtured you and establish these strong networks. And it comes with multiple benefits too. This means now, since you're secure, that impact that you're going to have initially is going to be 2, 3, 4 folds much stronger. It's going to hit harder. It's going to reach more people. And everything in life, especially these big impact kind of things, they're domino effects. You need to make sure that you're very sure of who you are as an individual and what you bring to the table. You need to be able to convince the people closest to you. And then the people closest to you are your advocates, and they're the ones that's going to drive the change. So make sure you, the start of this domino chain, is the strongest and the most secure. Then the rest will fall into place.
Raveen, how do you see the current problems emerging because of the war in the between Russia and Ukraine, and how
Yeah.
the energy prices have gone up by almost 300%, which is making it absolutely impossible to live in the UK. Now you're going to
Yeah.
go in the UK, right? I mean, how do you interpret this?
This is definitely not an ideal situation by all means. The Ukraine Russian conflict is going to have repercussions not just in like the immediate gas and energy prices or whatnot. It's going to have repercussions in intellectual property, how research is going to be shared in the European Union, how research is going to be shared globally. Knowledge is slowly going to become weaponized, where if you're a citizen of a certain country, let's say the Ukraine Russian war evolves, and I pray it doesn't, it evolves into a bio warfare kind of territory, then allies of a certain fraction might get the antidote and the allies of the other fraction would not. And then you're at mercy of like being in the right country at the right time. Then in terms of like, let's just take back a couple of layers. If you talk about the energy crisis, the biggest thing is now people are going to, like I mentioned with my previous answer, now people are going to start worrying about survival. They're not going to be in a headspace to innovate. They're not going to be in a headspace to think and research. And it's going to stifle what I think right now is already a stifling economy for the UK. The UK had a bunch of fallbacks with Brexit. Research is not free flowing as it used to be, a lot more regulations, even if you're like in a powerhouse like Oxford, more red tape to go through. Boris Johnson made some very questionable decisions. His successor is not looking that much better either, but in the name of the game, I cannot blame somebody who's just stepped into fill in the shoes of Boris Johnson. But there's a lot of complications that we have to deal with, and secure yourself first. That's like the only motivation that's going through my head as well, moving to the UK, ensuring that I'm in a stable footing, therefore that I can bring people up to the stable footing that I'm experiencing, and hopefully slowly but surely have a domino effect and bring everyone above the circumstances we're going to face. It's definitely scary times. The future is unpredictable. Bio warfare is definitely possible. You gotta hope and pray.
Raveen, yeah, it's very interesting times we are living in. I'm sorry, Raveen, I promised you that I will take only 45 minutes, but I already taken 1 hour 15. But I mean, the kinds of questions that I'm coming in is crazy. But I'm going to choose the one last question from you. Is that what is your what shall I say? How do you see uh, things evolving in this interaction between um, IT and health? And what do you see the future to be in the next? I'm not looking at too far away. In the next 2 years.
Next 2 years. With the interaction with IT and healthcare, right now what we're seeing is healthcare is such an analog-based system. There have been traditions that have been set in place for decades and people haven't questioned it, and that's how things operate. Right now, within the next 2 years, especially with cloud services like Microsoft, AWS, Google, they've been spending a decent amount of time coming up with libraries and cloud services that are in the medical space. For example, AWS has a service that helps you use natural language processing with medical lingo. So a doctor could literally be like, this patient has tachycardia at 120 beats per minute. And the computer will understand what tachycardia is, will record what the BPM is, and come up with contextually aware processing. That's one thing where I'm going to see what I see in the future is in the next 2 years, computers are going to be in a position where they can understand medical lingo and the diction to help automate processes that we see in like our day-to-day lives. You know, like how we have our Siri and like Google Assistant, we could literally be like, hey Siri, what's the weather tomorrow? Hey Siri, could you add an appointment to my calendar? Now you're going to have a medical Siri. You could be like, hey Siri, a patient has tachycardia with 120 BPM, blood pressure is 140/90. What kind of symptoms am I supposed to see if it is cardiac arrest? And now Siri understands all those technical features and it will tell you, this is what it is. This is what WebMD is saying. This is what's in the anatomy handbook. And you're able to pull down information much faster with your own voice, your diction, cutting up, like freeing up, improving efficiency by up to 60-70% at least. Then on top of that, we have computer vision and computer vision coming in that's able to identify, segment very sensitive regions of the brain, organs, and you're going to have better segmentation. Radiology is going to become more streamlined. You're going to get better diagnosis. You're going to get more accurate diagnosis. Your surgical pre-planning, your surgeon is going to practice your surgery in much better VR, virtual reality based settings, and have come up with like much better training than like physical models. When it comes to prosthetics and implants, right now we are starting to see people use 3D printing, and I personally worked on a project where we use 3D printing to take a 3D scan of a patient's mouth and then come up with the exact 3D deficit in the roof of their mouth and print just that, bringing down the surgery period from 2 weeks down to 48 hours. So we're going to see that. So the biggest improvements in the next 2 years, without a doubt, natural language processing using medical diction, computer vision for improved radiology, 3D printing for better prosthetics and implants. And then we are starting to see like a wave in brain-machine interfaces, like with Neuralink, Elon Musk Neuralink and stuff. But that's more like a 5 to 10 year kind of thing. But the other three definitely within the next 2 years.
That was fantastic, Raveen. I mean, it was a fast track of what are we going to evolve in the future. And lovely listen to you. I mean, I wish I can ask you more questions, but maybe the next session we will have when you're in Oxford, when you've started some work there. I promise you that I promise the whole audience that we'll definitely get in touch with Raveen, get a time from him, and where you can talk to Sri Lankans. So lovely meeting you, and thank you so much for giving some time over. Can I, Ruth, over to you, Ruth.
Thank you, Dr. Rohantha. Raveen, I think I have to point this out before I say anything else. Your passion towards healthcare was very visible throughout. The love that you put into the work that you do is impeccable, and I think for anybody in the audience, it is an inspiration. You have truly, with your knowledge and the way you've presented it out, should definitely be nothing less but a motivation and inspiration. So with this said, I'd like to thank you for your time. I understand you're busy with all that you do, with all that you have on your plate. So thank you for putting aside some time to be with our students, our alumni, and everybody and anybody in our audience, which is not very small. So as we conclude yet another MBA Diary session, I would like to send out my thanks to our IT team at APID for the technical support. I'd like to thank our students, our lecture panel, the academic staff, the alumni, our industry partners, and everybody in the audience for being with us for this session. And before we close, I'd like to remind anybody, if you have any opportunities, either job opportunities or internship opportunities, to do send it to us at APID, because we have an intensive and well-structured internship program, and we would like to see what you have. So do share that with us. And so before we close, I'd like to wish everybody a good day, a good night, and an evening from wherever you are joining us. Till we meet again next time.